Hello, Dental Online trainers, and welcome to the Dental Online Training Sharecast. I'm your host, Dr. Dennis Hartlieb. Each month, we'll talk with dental experts who are doing amazing work in the world of dentistry. Also, occasionally, I'm going to throw in a few of my solo bonding sharecasts, where I share a little with you about what I've learned along the way during my career. So tune in the first Tuesday of every month to hear the latest episodes. Hello, Dental Online trainers. I am Dr. Dennis Hartlieb, and welcome back for another episode of our Dental Online Training Sharecast. With me today, a good friend, a very good friend of mine, someone I love chatting with. And, you know, one of the things about this Sharecast is it affords me the opportunity to catch up with people that sometimes I only get to see them at meetings. We have a little short chit chat. So this gives me a chance to sort of hang out and just sort of catch up with friends. Today's guest is Dr. Brian LeSage from Beverly Hills, California. If you don't know Brian, he is one of the most skilled cosmetic and restorative dentists we have around in our country for sure. And one of the most accomplished dentists. And let me give you just a little snippet of his resume. He is a fellow of the American Academy of Cosmetic Dentistry, which is no easy task, as we've discussed on this podcast multiple times. He is a fellow of the Academy of General Dentistry, and he is a fellow of the American Academy of Aesthetic Dentistry. If you're not familiar with the American Academy of Aesthetic Dentistry, it's like a double secret society where sort of who knows who, and you get invited to do a presentation, and then you get invited in. And it's a very select crowd. It is sort of the who's who of the aesthetic and cosmetic dental world. And he's a fellow of that as well. So he's like triple fellowed, and I don't know if I know anybody else in dentistry that's a fellow of the AACD, fellow of the AGD, and the fellow of the American Academy of Aesthetic Dentistry. Brian, are there any others?
I don't know that either, even though I do know that Buddy and Jimmy Eubank are actually fellows of AACD and AAED.
And I think maybe Betsy might be fellows of those, and Mike Sussman, is he fellow of maybe
no,
not?
Neither one of those yet are fellows in the AAED.
All right. So here we go. So
deservingly of it, they certainly are, but they are not fellows.
So he lives on high ground. Brian practices in, like I said, Beverly Hills, California, which I want to talk about a lot because I have lots of questions about running a practice in Beverly Hills and staying mentally sane in Beverly Hills. So we'll chat about that in just a second. He went to University of Maryland Dental School, and I want to chat about that. And I don't know if I should offer condolences on the NCAA whooping, if you follow. But Maryland did okay, but then didn't do okay. So anyhow, with me today, my good friend, Dr. Brian LeSage. Yay, hear it from the crowd. Cheers. Brian, welcome to the podcast.
Thank you, Dennis. Yeah. Glad to be here with you.
We've talked about this for a while, and we're finally getting this going. So here we are. So, Brian, anything from that introduction that I left out besides the fact that you also teach at your office? You have a teaching center, the Beverly Hills Institute for Dental Aesthetics, BHIDE, and you do some programs there at your dental office also. Anything that I left off about your resume that you wanted me to make sure that we talk about before we start talking about your past and sort of your influences and all that stuff?
Yes, I'd like to add one thing, which is because I'm a Bruin fan, really. So the Bruins are still on the right track.
There you go.
I started the UCLA Aesthetic Continuum in 1997. So it's the longest standing university-based continuum. Aesthetic continuum, maybe in the world. I don't know about the world, but certainly in the United States it is. So I'm proud to have started that. Where we got shut down for COVID. Looking to start it back up. We did 24 years. I wanted to at least hit 25 years of running the continuum, and I'll probably go longer than that too. So that would be the only thing I think you really said enough.
I'm glad you brought that up because I want to talk about that as well, because I think that's something that's really interesting to me, and I think to some of our listeners will find that super interesting as well. The other thing is Brian and I have gotten to know each other even more through the American Academy of Restorative Dentistry, one of my love and passion projects, working with the Restorative Academy. So we've gotten to know each other well through that as well. And Brian, I wanted you on my program this year, but you got bumped over to Amanda's program. So I will tell you that I did have you on my program, and they stole you over to the clinic. So sorry you couldn't be on my program for 2025. But
I'm sorry about that too, but okay.
All right. So Brian, where'd you grow up?
I grew up in Baltimore, Maryland.
All right. So that's how you ended up
So
in Maryland. Where'd you go for your undergrad?
I went to UC Davis. So my dad was in the public health service as a pharmacist, and so we moved around a little bit, which influenced really my personality. Probably I would tell you in a negative way. But anyways, I grew up in Baltimore, lived there from age 2 to 13.
So your dad moved you guys around a bit because he was in public health
Yeah.
services. What were the influences of seeing what your dad was doing with public health services? Like how much of that came home and what were you witnessing?
So when he moved to when we lived in Baltimore, we were actually on this was not a fun part of my life. We lived on a psychiatric institute, so it was a special area, and my dad was one of the chief pharmacists there. And they, in those days, we're talking about the '60s and such. Um, they would make the compound drugs. They would make all the drugs, and so he'd bring me into these sort of factory warehouses, and I'd look around and see these drums of drugs. It's like, what's in there, Dad? Oh, that's a blah blah blah, and I go, that's interesting. But more importantly, actually, then when he relocated from Baltimore to San Francisco, so that's how I got into California. Was in a little north of San Francisco, very small town, 17,000 people when we moved there, and he was a hospital pharmacist, and so now he worked in a hospital, and I loved going to the hospital with him. Absolutely loved it. The other pharmacists, I would ask them questions about medications and drugs. And my dad, whenever he went up on the wards, I said, Dad, please take me. And I love going up on the floors and the wards. And my dad was a really smart guy. And the nurses he had a kind of fun little sense of humor. The nurses loved him. And it would just walk through and see the Bob, what's going on, and why is that patient in there? Because they would ask him technical questions, and obviously I didn't know what they were really talking about. I was
Sure.
13, 14, 15 at the time, but it was fascinating to me, medicine. Probably that was my really, true introduction to medicine and healthcare. Watching my dad being, giving advice and such to, the physicians looked to him for really in-depth information, and I still have talked to my dad. He's still alive. I still get to talk to him and ask him to share stories about, when we went up on the wards and how the doctors really, really respected him because he was really a brilliant chemist, which in those days, as a pharmacist, that's what you had to be. Today,
Right.
I'm not sure you have to be such a great chemist today, but he really was, and some of his stories are crazy fun.
Well, I mean, that obviously leads to the first question is like, how much did you get to play around with psychedelics then as a dad, as a pharmacist in the 60s?
None. Okay. Yeah, that was. Okay, I'll tell you this story, which is kind of, I probably shouldn't. I'm not going to tell you that story because
All right, fair enough. I would love to talk to your
nothing
dad
with
though
me.
about
Not drugs with me. Well, my dad had a little pill bottle. Okay, I'll tell you. And when we took a road trip and we had to drive very far, after a couple hours into the road trip, my dad would ask my mom. Now there's 7 kids in a station wagon. Okay, so how do you fit 7 kids in a damn station wagon?
right.
A road trip from Baltimore to Boston, which is where all our relatives were. And my dad would say, "Give me a half a pill." Okay, and and we had no idea what the hell this pill was, and
Right.
you could guess, it was what the truck drivers took in those days.
Little speed, got to keep them going.
Yeah, so it's like, okay, just a little pill. Okay, Dad, all right, great.
Yeah, it's interesting. These psychedelics are coming back into vogue and for treatment and depression and other things. So I bet your dad's got some great stories. But
He
anyhow, as a kid growing up and seeing your dad in this profession, that's got you sort of, I'm assuming, interested in medicine and that type of thing. So where does dentistry fit into all that in your life?
So a couple little things occurred there, which was I was at UC Davis undergrad, and at UC Davis is a bit of a farming community up in Northern California.
Right.
And so the Mexican American farm workers' children, there was a school bus, a dentally equipped school bus that would show up every Thursday or Tuesday, whatever day it was. And the members of the dental study club at UC Davis, which was a pretty big study club, amazingly so, would go, whoever wanted to, would go and assist the dental students. So UCSF dental students would come with the mobile clinic. I'm not sure actually all came together, but and so I was thrown into being a dental assistant. Fascinating. I mean, I couldn't speak Spanish at all,
Right.
and so there's these little kids, and the bigger kid would come out of the bus, and the little kid was sitting there and go, "They got a needle this big," and you just started learning Spanish, it's like needle and abre la boca, you learn some things. It was
Right.
good. but it was like, don't tell them that. Come on, don't tell your little sister that. You
Right,
know?
right, right. That's
Yeah,
what big brothers do.
yeah. And so it was really fun for me. I just saw this and said, wow. So that was a big influence. I mean, that really was a turning point in my career. I also realized, kind of like you, Dennis, I know how dedicated you are to learning and continued learning. And I knew that if I went into medicine, which my dad had me, I could have got into any medical school almost anywhere. My dad had connections everywhere. I'm not
Sure.
probably not anyone, but certainly I had connections, and I could have got into a medical school. Uh, and my dad really thought I'd be a great physician, and I think I probably would have been a great physician, but I knew I would have killed myself because I would have had a hard time leaving the hospital, in
All
the evening.
right.
Really would have, because I just know that I had sick people, if you will, that I was caring for, and I knew my personality, that
Mm,
that was not going to work well with my personality. I just care too much, and that would have been too hard on me. So, and I just knew I wouldn't be able to have a family, and family for me was very important also. So it's kind of like, okay, I could still do medicine,
yep.
and be in the medical field. And I think I'm pretty good with my hands. And I did a lot of crazy drawing projects as a little boy, as a young man, and very detailed work with my hands. And my mom would always, encourage me, oh my God, you did I did little plastic cars, putting the pieces all together,
Yeah,
glue it all
sure.
together. And these things were meticulous. I mean, you didn't
Right.
see glue, you didn't see any of the super glue, whatever, modeling cement. Uh, I did a huge Cutty Sark as a young boy with all the lines and everything. And I never wanted to throw it away, but I was like, I didn't know what to do with this thing. But
Sure.
it was really, my mom would just love, my dad, was busier. My mom would just go, wow, Brian, that's something. I had 5 sisters, and they're like, why do you spend so much time with that, Brian? That's just stupid. It's like, because I love this. I love putting these things together and just making it
Right.
so precise. And so that's kind of was my start, really. I think was doing a lot of small little model work, a lot of drawings as a young boy, young man, seeing the dental students. God, it was just fascinating to watch them. We're putting amalgams in these kids, obviously,
Right.
uh, and but also seeing a child come in, almost petrified,
Right.
and then see them leave with really a smile on their face, and just kind of saying hi and even hugging you. Wow, how much more rewarding, can your career be? And I still hug a lot of my patients here. There's no question.
Right.
It's very personal what we do, Dennis. You know that, and I
Yeah.
know your listeners know that. It's very personal what we do, and so I touch a lot of shoulders when I come in the room and hug them usually when we're done. I just think it's so important. The human touch, I think, is so powerful,
It
so
is.
powerful. Just that little touch on the hand, whatever it is on the shoulder, it's so powerful in my thought process.
A couple thoughts come to mind. Frank Spear did a great presentation for the aesthetic meeting a few years ago on influence. I think that was Coronado where he gave that his influence presentation.
I believe it was,
Yeah,
yes.
yeah. I think first time I saw that, and boy, in doing these podcast interviews, it's so interesting how so many of us where our influences come from, right? So you're at Davis, and you could have been at any other college, and you wouldn't have had this dental program that was outside the front door, right? And
Mhm.
so it's simply happenstance, right? That this just happened to be there, and you connected with it, right? And the person that you are, you fit right into that. And if you had been at San Diego, if you've been at San Diego State or somewhere else, would you have had that same influence? And here you are, decades later, simply because of that situation and the person that you are. I think I over and over how people get influenced into dentistry, I think is just remarkable. And I think that's just another crazy story of how it just sort of happened. The other thing I talk about this, my dentist was this really nice guy, Dr. Prisk, really, really nice guy, old-fashioned dentist, stood up, didn't use anesthetic, but was really nice, was nice to us as kids, and was just a nice guy. And my physician was kind of a jerk. And it made a big impact on me. And my thoughts going into dentistry was I got a really nice guy that's modeling dentistry, and I got a guy who's not very nice modeling medicine. It really sort of positioned me towards, dentistry is more about being, having relationships with patients. and being nice and all that. And so that really, and what you said also, then, you get to really impact patients, and you get to have these relationships with patients, and in the touch and the communication stuff that we get to do. So I think for most of us, it's probably at a higher level than what you can in medicine, or what is maybe exhibited in medicine. I don't know.
I would agree with you, especially with the HMO type medicine where they literally have 5 minutes, 7 minutes. They're told that's really what they're really told. They're told unofficially, but
Right.
5 minutes to 7 minutes to deal with this patient's problem. Wow, I mean that would not be fun for me. I wouldn't want to practice medicine that way. Lifetime relationships that you establish with a lot of the patients, and the
Right.
trust. It's so fulfilling, really. It's so fulfilling just as a human being. Forget your healthcare professional, but
Yeah.
just a human being. I mean, I know you hear it a lot. I know your listeners do too. When patients come in and say, Brian, I don't like really sitting in your chair, but I really like you.
Right. Yeah.
And I, what do you say? I say, I understand. I totally understand. But let's get you through this and take good care of you. And I know, Brian, you're going to do it. You're going to do great work. Okay,
Yeah.
And
It's nice being human with patients, isn't it?
yes, yes.
Really is. All right. So tell me, after you were getting through UC Davis and then you're applying to dental schools, how'd you end up at Maryland? What was that about?
So kind of interesting. My
You weren't.
brother had graduated from the University of Maryland Pharmacy School, which is where my dad did teach part-time. So my dad taught when we were in Baltimore, he taught part-time at the pharmacy school. And my brother went back to Maryland to do the pharmacy program there. He went to UC Santa Barbara here. So we both were in California schools. And my brother said, why don't you apply to Maryland and, we'll hang out. I said, okay, that sounds cool. So I only applied to two outside dental schools, which were, out of state dental schools, which was Maryland and Tufts.
Hmm.
And kind of interesting, Dennis, that I applied to all the California dental schools. I don't believe I applied to SC because I didn't have those kind of funds. So I was going to have to pay for my
Sure.
own education. And so SC is a private school.
Right.
And I got waitlisted on two of the California schools, and I got into Maryland and Tufts. And it's like, geez, that doesn't make a lot of sense, but okay. And so, I said, I'll go to Maryland. I mean, I'm kind of familiar with Baltimore, at least a little bit. My parents are familiar with Baltimore. They might come visit, maybe.
Right.
And the funny part of the story, though, is literally the day that I drive into. So I packed up. I have a Chevy Vega. I packed up a U-Haul, okay,
Yeah.
and drove across country with a Chevy Vega. Okay, you laugh because you know what a Chevy Vega is. Not all your listeners know what that is.
Well,
But that
let's
was
just say this in Spanish. The big problem when they tried to sell the Chevy Vega south of the border, Vega apparently in Spanish means no go.
yeah,
And so the Chevy Vega did not sell well. But and it would actually, ironically, it was not an awesome car. But go ahead with your Chevy Vega and your U-Haul trailer.
Yeah, so I got all my stuff in U-Haul and I'm driving across country. Went through Chicago, okay,
Sure.
and got to Baltimore. My brother says, "Hey, when you get here, go to my girlfriend's apartment." Okay, I didn't know this girl from Adam, but great lady, marrying her. She was just sweetheart, Marianne's sweetheart. When we hit it off right away, and we always tease with each other, we're the favorites. So we just I love her. She's fabulous. And so my brother shows up after work and he goes, "Hey, well, we got news for you." Okay, what's the news? He goes, "Well, we're moving back. I'm moving back to Washington, state of Washington." I said, "Okay, Russ, that's interesting. All right, well, I'll manage. I'm a big boy." But
Right.
literally this day I show up in town and she's a great cook, cooked a meal. We're sitting there having this meal, a little bit of wine, having a nice time. And just getting caught up with my brother, who I didn't see a lot in pharmacy school and such. And now he's working in Baltimore. He's heading back. He married into the apple industry. So he married into the apple industry. And so he quit pharmacy and ended up managing the family's apple orchards and started some of his own.
Wow, how cool. That's neat.
That's how I ended up back in Baltimore. And you want to hear a kind of a really bizarre, not bizarre, but interesting story, actually, Dennis, is so there I am, and we have orientation for dental school. So maybe a week later, so we have orientation for dental school, and it's in the basement of the dental school in this little room at the University of Maryland. And it was an older dental school, but not too old, but it was an older dental school. At the time, they got a beautiful dental school now, brand new. Well, it's not brand new now, but it's a gorgeous dental school. And I had one of my best friends from sixth grade. I was in Catholic school at the time, all right, before I left Maryland. So I'm in Baltimore at a Catholic school. Bob Grill was the kid's name. His dad was a dentist. I went over to his house quite often. They lived pretty far away, but he was my best buddy. Smart kid. Like I said, his dad's his dentist. His dad would come home from work, and the mom would serve him a martini or something. My mom and dad never drank. My mom and dad didn't drink much. You know, um, and it was like, okay, kind of leave it to Beaver, kind of,
Sure.
fast forward, 8 years or so. Never spoke to Bob. Wrote him a couple letters as little boys, 13-year-old. Hey,
Sure.
how, and so I'm in the orientation, and I got flip flops on. I look like an idiot,
Right. From
California.
California.
Yeah, and there was two other kids with flippers on. You knew those. I said, "You're from California. You're from Cal," and everyone knew we were the idiots from California. I didn't really. I did care a little bit, but I didn't overly care. But I wanted to start out a little different. That's really was my goal, And some of some of the other people had suits on and ties and jackets. Listen, I straightened up when I had to, but I
Sure.
wanted to start out a little fun and make people go, "Hey, who's this knucklehead with
Right. Right.
flip flops on? Are you kidding me?" you know, and. And so I'm sitting there talking to someone, and out of the corner of my ear, I hear, "Yeah, hey, Bob Grill," introducing himself to someone. I said, "There's no way in hell that's Bob Grill." I said, "Are you kidding me?
That's so
My
funny.
best friend from sixth grade." And so I said, I ended the conversation with him. I said, "Excuse me, this person behind me, I know from elementary school." Okay. And they go, "That's impossible. You grew up in California." I said, "Yeah." So I get up and I stand and look. I said, "Excuse me." And I look right at him. And I said, "I know you." And he looked at me and he goes, "Brian."
How
I said,
funny.
"Yeah." I said, "Yeah."
That's
He
great.
goes, "Oh my God." And there's Bob Grill. So we were very good friends through dental school. So even though I lost my brother, I had a good
Right.
friend from elementary school. So, just fun little
That's so
story.
cool. What do you I mean, dental school was a while back for both of us. What do you remember like those first days, those first months coming into dental school? What do you remember?
The one word I would tell you, maybe intimidation.
Yeah.
Um, you know, UC Davis is a quite academic school, and I did pretty well. But wow, got into dental school, and I said, "Geez, these kids are smart." I said,
Yeah.
"I'm a dummy.
Yeah.
I'm going to have to step it up."
I had the
Um,
same experience. I went to Michigan undergrad, got into Michigan Dental School, thought I had this huge advantage coming from Michigan undergrad. Holy cow, there's a lot of smart people out there.
yeah,
Whoa, a lot smarter
yeah.
than me, I can tell you that.
That was. I said, "Well, holy smokes," and I worked through undergrad to pay for my undergrad, and I wasn't going to pay for dental school. I knew I was just going to go in debt, and my goal was really just to become the best dentist I could. And really, it was. Listen, all my classmates would tell you that Brian was a gunner. I mean, there's no question. I studied as hard as anyone. I was determined as hard as anyone, and one of the things I give my mom a lot of credit for it. Honestly, she really drove me. She always asked, "Is that your best effort?" And I ask the same of my kids, and because I think I think it's an important question. It's just, in your heart of hearts, do you know that's your best effort? And if it is, and you get a B on that test, hey, it's okay. I mean, go back and
Isn't
learn
that
the
the same?
material.
Isn't that the same question you ask every day when you're doing dentistry?
Oh, absolutely.
Is that my best effort? It may not be my best dentistry. Was it my best effort? I mean, because there's going to be patients that are just going to allow us to do our best dentistry, right? But
Yeah,
is it my best effort given that situation? A patient can only open 20 millimeters and we're trying to do some restorations and they can't open, or they're moving around, flopping around like a fish, or whatever the dynamic they bring in, or maybe there's, what issues with ourselves, but is it the best effort that we could put forward? And I think I think that is key for anyone out there listening, or young dentists. Just ask yourself, is that the best you could do? Did you give your best effort?
yeah.
Right.
Yeah.
And then leave it at that. I think that's great advice from your mother. I think that's
Yeah,
very,
it
very
was
good.
interesting. I took it as a positive advice. A couple of my sisters really, didn't like it.
Ah,
They found it
right.
negative, which is, I don't, that's a personality thing. I said, "Wow, you took that negative." I said, "Wow, I only took that as, you
That's
know,
funny.
she just, she did. My mother expected a lot of. She expected us to get straight A's. I'll tell you a funny story. I graduated number 5 out of 155 students. Okay, so that you probably call that a gunner.
So you worked hard.
Yeah, I worked very hard, and my mother said, "Why weren't you number 1?" when she found I was number 5. It's
Yeah.
like, okay, mom, she's okay. Well, there was a lot of smart people. I passed a lot of smart people,
Along the way.
you know. But okay, I mean, I hope you're still proud of me. He would tell her, and no, she would always, no, I'm proud of you. Of course, I'm proud of you. My dad would always step in there and go, honey, really, 5 out of 155 students? Come on, give the kid a break.
That's not so bad. That's not so bad.
Yeah.
When you got into the clinical aspects of dental school and stuff, were you relieved? Were you excited? Were you stressed? Do you remember what it was like when you first started like actually doing dentistry on people?
I enjoyed it. I really enjoyed it from the beginning. Certainly, the transition from typodonts that we all take to patients is challenging, but I really felt well trained. I will tell you a funny story, and Dr. Bradbury, I can tell you in a moment. The first class 2 restoration I did, and maybe the first restorative procedure I did, I can't remember if it was the first one, but so basically got the numb the patient, have the rubber dam on, and I cut a perfect class 2 preparation. Okay. Perfect. I mean, box perfect, undercut a little bit. It's perfect. Okay. Extension. I got all this crap. And I call him over and he goes, Brian, what do you think that orange stuff is? Go, I don't know.
Right.
And he goes, you really don't know. He looked at me like I was an idiot, and I was a
Right.
pretty good student, and I said, I don't. He goes, that's decay. I said, oh, that's decay. Okay.
That's what decay is.
I worked on typodonts. I said, I got
Right.
a perfect prep like we did on a typodont,
Yeah.
and, never made that mistake again. I remember I got a big C for, removal of decay. I think you probably want to
Right.
get a D, but how did you know them? When you think about it, you go, you
How do you
just worked
know?
on typodonts your whole career. And so it's, so kind of embarrassing moment to share with your audience, but I'll do it anyways. Why not? I'm old enough. Who cares?
Yeah, I remember one of my preps and I brought someone over and they're like, you're still in enamel. Can you drop that? I'm like, I don't know the difference between enamel and dentin. We've been cutting plastic teeth. And
Yeah.
actually, then back in the day, we used to have bins of extracted teeth that we could practice on.
Mm.
And I spent an evening, and I remember this. I was in the lab one evening and I just took teeth and I just kept on prepping to feel the difference between enamel and dentin when I would hit the DEJ. And I
Mm.
did that a zillion times until I started to get that feel for it, like riding a bike. And then after that, then it's like, that's what it feels when you drop through the enamel. But I didn't know because we were just working on plastic teeth and, here you go, real world. So,
Sure. Sure. Yeah.
so we're all learning, continual learners, right? Especially when we're in dental school. God, there's a lot to learn.
There is a lot to learn. Um,
You
yeah,
went back out to California for your residency.
I did. I did. So I applied at Johns Hopkins and I applied at UCLA. Those were the 2 main ones. I applied a couple other ones, but those were the 2 ones that I really wanted. I mean, listen, I knew I was a pretty good candidate. I had good grades. I mean, most of the people in the top 10 were going for a specialty program, really.
Right. Yep.
And I still remember Dr. Bushness came down to my cubicle right, the week of graduation. He said, Brian, what are you doing anyways? I said, oh, I'm going out to UCLA to do a GPR. He says, oh, good for you. That's, you're going home. Yeah. Get back in California. And he says, I'm so proud of you. I said, okay, thank you. And I kind of like, what do you, he says, well, it was one of the nicer compliments in my career. It was 2 nice compliments coming out of dental school. He said, he says, we need really smart, talented dentists to stay as restorative dentists, as general dentists.
Right.
And never really thought about it, but I remember him still saying this, a couple times a year, probably, that just, we really need some smart general dentists. A lot of the top 10s go into pros, go into perio, go into oral surgery, go into ortho. And that's why most of them work that hard, because you needed to be in the top
Sure.
10, top 10%, whatever the deal is to get in these programs. So I enjoyed and enjoy general dentistry. I looked in and said, I love oral surgery. I still do. I still take out wisdom teeth. I take out pretty sophisticated wisdom teeth. I do IV sedations in my practice because of the training that I got at UCLA. It was a hospital-based program. I got into both Johns Hopkins and UCLA, and the gentleman that interviewed me at Hopkins really liked me, and he was very kind. I've been so blessed in my career and my life. I really have been incredibly blessed. I know, Dennis, you feel the same way. But he called me up the night before my UCLA interview, and he said, "Brian, you're in. We want you."
Hmm.
And I thought, why would he tell me that? Why the heck would he tell me that? Because I'm going to use that at
Right. For
UCLA.
sure. Yeah. Yeah.
And interestingly, at UCLA, I had two of my roommates, the senior year. There were four of us that lived together, typical housing as dental students.
Sure. Right.
There were four of us, and we had a four-bedroom, nice little apartment. And three of us applied to UCLA's GPR program, which kind of
Oh,
made
no
no
kidding.
sense. And
Hmm.
and so and one of the questions, of course, you got asked is, Brian, why should we pick you over your roommates?
Because they're slobs. They don't pick up
Yeah,
after themselves.
yeah. They
They
don't
don't
do
make their beds
dishes.
in the morning.
you know,
Throw them
uh,
under the bus.
so it was a great question, but I was able to tell them that, listen, I'm already in Hopkins, and everyone knows Hopkins is a fabulous institution. But I really did want to go to UCLA. That was my first love. Really was to be trained at UCLA. You say the word UCLA anywhere around the world,
Sure.
and they know where you are. Even I would tell you even more so than Beverly Hills, which I mean, most people have heard the name Beverly Hills, but I think UCLA is world renowned. A staple. I've traveled to a couple countries where I would ask the tour guide or something, have you ever heard of UCLA? And I've had a couple times no, which really is mind
Mm.
boggling to me. But pretty much UCLA is known everywhere. And
Now, when
it's
you finished your program, how did you start out in practice? What was your initial getting into a private practice and stuff like that?
so so I'm in Southern California. All right. So I'm here in Los Angeles finishing up my program. Well, interesting, Dennis, I hadn't passed the boards yet.
Sure.
So
Right.
I had just taken the California boards, which in those days was impossible. 50% of the out-of-state students at best passed the boards, at best.
Mm-hmm.
So I was an out-of-state student, but the good news was the senior dental students liked me. So as a GPR, they would come into the GPR clinic, sometimes watch us work. I became friends with some of them, and it really worked out to my advantage. And so they treated me like a UCLA student. And so I had a setup that I looked like I was a UCLA student, and most outsiders, if you will, didn't.
Sure.
So you had
Yep.
different stuff, okay, from
Right.
instruments to hand pieces that you look like a foreigner, if you will,
Yeah.
and that wasn't a positive for you.
For sure.
Uh, and so I had taken the programs go July to June, but I took the boards in June. So now all of a sudden I'm sitting there going, I won't know the answer to this till maybe August, maybe September, maybe October. So what am I
Right.
going to do in this transition period? And the truth of the matter is I did find a doctor who said, okay, just as long as you pass your boards, obviously, we'll hire you. And they were going to pay me $125 a day. Now this is
Mhm.
1983, but I still said, wow, $125, that doesn't seem fair. And so,
So just for those who can't do the quick math, that's around 30 grand a year.
yeah, yeah,
That's just
it was less, I think, than I got paid. It was about the same that I got paid in the GPR program, which,
right.
you expect a residency, you're not going to get paid well. Yeah, but they're actually teaching you. You're going to learn something in
Sure.
the residency
Yep.
program and get a lot of experience, which was really a fabulous program. And so I said, well, that doesn't look very good. And so I said, okay, let me just reach out to University of Maryland, because Dr. Bushness, when he gave me those kind words, he said, Brian, anytime you want to come back here, you're invited. And so, I remembered those words. And so I called him up, said, hey, Dr. Bushness, I finished my GPR program, wouldn't mind coming back to Maryland. Would there be an opening? And he said, Brian, you're absolutely. And so I moved back to Maryland, joined as an associate in a private practice in Washington, D.C., and then taught at the dental school. So that was the start of my career. Is I was an associate 2 or 3 days, I think 3 days a week in a practice in downtown Washington, D.C., very similar to your Chicago situation, beautiful downtown area, and taught part-time at the dental school.
How long were you then in Maryland before you headed out west?
Yeah, so I was in Maryland from 84 to 90. A lot of people don't know
Oh,
that part of my story, which was so I practiced in DC, taught at the dental school for about 3 or 4 of those years. But from 84 to 90, I was in Washington, DC, and really had a fabulous time. Loved Washington, DC, loved the patients. the one story I would tell, I think, because the people listening would kind of enjoy this, which is, um, honestly, I sort of got fired from my first job. And he didn't really fire me, but he certainly let me go. Very cordial though. We're still actually friends today. So it wasn't a bad breakup, but he was a good dentist. He was a better businessman. So that was really helpful for me because we
Sure.
don't learn any business in dental school. So I learned some of the business side of dentistry. So when I left, I said, hey, I'll be able to take my patients with me. And he said, of course, but we want to see what charts you're taking. I said, well, that's fair,
Yep. Sure.
and so, I had literally, Dennis, I had a box this big, a really small little box. Okay.
Yep.
And I had roughly 50 patients in this box.
Okay.
And I'm walking down Hay Street in Washington, D.C., one of the bigger avenues in Washington, D.C. And I'm literally holding this box in my hand like this, and, a little heavy because I got 50 charts and x-rays and stuff.
Right.
And I look down at the box and I'm walking. And I look down at the box and I go, this is your dental practice.
Ha. Yeah. No kidding.
I'm looking, I'm going, 50 patients. How many days is that going to fill? You know?
Right.
And I said, I better learn some verbal skills. I better learn the skill of how to ask patients to refer patients to me. And that
Yeah.
was a very pivotal moment in my career, that when I looked in that box and said, holy smokes, this is what I have. I was in DC for 2 years at the time. There I had 50 odd patients. And how was I going to grow a practice? So I started a practice from scratch. I rented one operatory from another dentist who had built a nice office, had two operatories available to me, but I really had one. I could use the overflow room if I had to, but he got a little upset with me if I used it much. So I try to be courteous. That's not the right thing to do. I was paying for one room. That's what I had to kind of stick with.
It's interesting. I think for people who are associates or going into associate positions, one of the things that I had to learn when I joined with Mopper and when my associate or my partner Chris joined as an associate is when you're an associate, you got to grow your own practice. You have to build a practice within a practice, unless someone has retired and they're giving you a practice, or someone's passed away and there's a whole slew of patients. But in most practices, when you come in, there's no dentist that's working 80 hours a week so they can give you 40 hours a week worth of patients. You have to grow a practice. And so much of that is developing the verbal skills and understanding how to connect with your patients and how to plant the seeds to be able to do the dentistry that they need, that you want to do. But it doesn't happen immediately. And so much of that is overlooked. And I think so much is taken for granted. And certainly I did when I went in as an associate. I thought, oh, well, they're just going to start feeding me patients. Well, you gotta create a practice. And hopefully the person that you're with will help you create that practice, will help you build the practice. But it's incumbent on the associate. You have to realize you have to build a practice within a practice and hopefully have great guidance and great support. And that was something that I had to learn. And it sounds like maybe that's something that you had to learn along the way also.
Oh, absolutely. I mean, looking down in that box, I still, the feeling that went through my gut at that time.
Yeah.
I didn't tell you, as I alluded to earlier on, when we moved around, all right, as a young man, it really caused me to be very shy. And so I really, as a young man, most people that know me and see me public speak would think, there's no way this kid was shy. This guy can't be shy. But as a young man, I was incredibly shy. I mean, to me, public speaking, I don't have any problems with it. But I can tell you, I took a public speaking course at UC Davis, and I would almost throw up before I had to do the public speaking. I hate to
Interesting.
say it, but almost. I didn't. But I mean, my hands were as sweaty as they could be. I mean, it was challenging. And these are standing up in front of 20 knuckleheads. I mean, I don't mean to put it, just
Sure.
your friends.
Right.
Who cares?
Right.
You know,
Yep.
it's not some smart dentist standing out there or something. It was just and you're telling some story. So um, I saw my dad was also a teacher. He was an educator. So in pharmacy, he testified in front of Congress. My dad over CE requirements, actually. So I saw
Mm.
my dad do a lot of things. I remember standing in the back of the room and watching my dad in front of 500 pharmacists, whoever these people were. I figured they're
Sure.
pharmacists. I sometimes tell the story to my dad just because subliminally it had obviously an effect on me,
Right.
where now I teach and share. But it was challenging for me. I was very shy. So for me to stand in front of even my classmates, like I said, at UC Davis, and then to teach at another level was hard. But I also always in my life don't like to have fears, and so I've always took on fears kind of head on, which is a weird human nature character of me, honestly. But like I have a fear of
Mhm.
drowning. And so I scuba dive. That's stupid. Why would I do that? But it's like, I don't know, why do we have to have fears? It's not scary. I mean, it's scary to go stand in front of people, but it's not going to kill you. Now, scuba diving might kill you, might get,
Right.
but just standing in
If you
front of,
run out of oxygen, that could be an issue.
yeah, learn that trick at least, to know how to look at your gauges, and you'll probably do all right. But
I think one of the things that makes things fearful for people is that they don't have control over certain situations. So I think, people who are fear of flying, they don't have control. They're used to driving, they have control. They got the steering wheel. People, when they get into an airplane, they lose that control. People fear of swimming, right? Lose that control. So I think maybe diving into it, no pun intended, is that you want to learn to get that control of those things that are giving you fear so that you can overcome those issues, is what I would think. And I think that makes perfect sense. And I think that's an issue in dentistry too, because so often, there are things that are, when we're looking at treatment for patients and looking at complex treatment, we think we can't do that. And it's scary and it's fearful. But it really is making that dive in to learn how to be successful doing those procedures. So overcoming that fear so you can do more dentistry that's, I think, this more challenging and more enjoyable, quite honestly. So I think that sort of fits in a lot with probably what you're doing in your dental world, and doing sedation and taking out third molars and stuff like that, just sort of overcoming those fears and just sort of diving in and doing it.
yeah, fun and profitability, I'd add to that, Dennis. Also,
Well,
you
yeah,
said enjoyment, and so certainly, but gosh, I say we picked a very hard profession. Okay, dentistry
no
is
doubt.
not easy to do. Most dentists
Not
have some
easy.
neck aches, some back aches, something, and the psychology that goes into it. It's a very, very challenging profession. I love what I get to do, but it certainly is. It can be very fun, but it certainly is very challenging at so many levels. And you're right that I didn't just dive in doing, horizontally or vertically impacted wisdom teeth, just aimlessly, just carelessly, I should say.
Right.
I was well trained at UCLA. I took very difficult cases out. I assisted the oral surgeons, residents, as they took difficult cases out. The head of oral surgery liked me because I was there. I was
Right.
working. Where I'm going with that, as is training. Mentor. Who's your mentor? Mentoring. Study. I mean, I'm in my private office right now I'm in my dental practice, and I mean, over here I've got journals. Just journals. Journal of Prosthetic Dentistry. Journal of Aesthetic and Restorative Dentistry. Journal of the AACD. They're all around me. My kids. I go on vacation. The funniest thing I can tell you, Dennis, my daughter, about 3 years ago, she goes, "Baba, I want you to go on vacation without your computer."
I know, right? So
And,
what's
and
that like?
I
What's
said,
that like?
"Honey, there's not a prayer in the world that'll ever happen."
Yeah.
I said, "I hope I don't disappoint you." She goes, "Baba, can't you just like not go without your computer?" I said, "No, I
Yeah.
can't." I
I
said,
get it.
"There's lectures on there, there's work on there, there's stuff I got to do." And so she goes, "Yeah, but why don't you just put it down? Like, not do it?" And my wife's looking at me like, "Yeah, listen
Yeah,
to your
that's
daughter."
she's been wondering the same thing.
And I said, "It just isn't going to happen. That's not in my DNA." I
Yeah.
said, it's the old adage, the old verbiage that you don't know what you don't know, or the more you know, the more you realize you don't know. Right.
Yep.
So the more you know,
Well,
the more you don't know. And so,
and that leads me to my next question. So you've been a accredited member of the AECD for decades, and then a fellow. Not that didn't take you long after that. How'd you get involved with the AECD, and was that your first introduction into aesthetic dentistry, or cosmetic dentistry stuff, or what was your how'd you get into all that? What was your route?
uh, first of all, I enjoyed it. Okay. I'll tell you a really funny story. So, as an associate in another office in the Maryland area, the owner of the practice worked on his mother-in-law and did some bonding on the front teeth.
Okay.
And the mother-in-law went home crying. I didn't know this. I was in my back operatories. And the dentist came to me and said, "Brian, would you come and at the end of the day and fix this bonding?" So, "What do you mean, would I come and fix the bonding?" And he goes, "No." He goes, "You got a good aesthetic eye. So will you come, and maybe you won't do it, but at least tell me what I need to do." And so I sat there in the assistant's chair and told him, "Okay, well, move that line angle over a little bit, make this edge, and this is 1988, where there weren't a lot of courses in aesthetic dentistry.
So where were you learning that? Like, how'd you know to move the line angle? How was it from your waxing courses when you were in dental school? Was it from continuing education you had done? How'd you know to tell them that?
Yeah, a lot of it was, I think, the waxing courses. Certainly, we did a lot of waxing. I know you probably did also in this generation. The newer generations aren't doing as much, which I think is a shame. But it was interesting. I had a very influential lecture by Dr. Bob Stein. So Bob Stein headed PROS at BU, I believe it was. And this was 1985 or so. I still remember it. And he said that a tooth has like 138 trapezoids in it. And he had the drawing of the tooth with 130. I assume, I didn't count them.
Right.
But it was a lecture on aesthetic dentistry, on tooth form, tooth contours, and such. And I sat there and was fascinated by his lecture. I mean, just blown away by this lecture. And the funniest part, it was an all-day lecture. At lunchtime, 3/4 of the room left. There was a handful of us left in the afternoon. I felt bad for the gentleman because that's really not nice. But he was just teaching at such a depth that, for me, again, it goes back to that little model making, and I was just moving little tiny pieces, and it was like, wow, okay, 130, okay, I get it. I think that was probably besides the waxing in dental school and the preciseness that we really needed to do it at, I think that was probably the next thing that influenced me. I went to the first AACD meeting in 1992, and that's where I heard of accreditation. I forget how someone invited me, or there was a notice saying, hey, if you want to become accredited, I don't even know what that is, but okay. And I went to this session, accreditation, and I said, that's cool. I mean, I'm out of school here, almost 10 years, and never been graded, since dental school. Right. And wow, it'd be really cool to see my colleagues, quote unquote, sort of validate that I'm a decent dentist. All right. So that really intrigued me. And so that was 1992. And 2 years later, I was accredited. I just, worked hard at it, read as much as I could, anything that was out there, studied. I remember going to Bill Dorfman was my mentor. We had very casual mentors in this day. And so I went over to Bill, and Bill knew me a little bit peripherally. He was just starting Discus Dental. So he knew that I was a young guy in town, just kind of, and we were both the same age. And so we had a little initial friendship. Actually, I just saw him at the mall yesterday, which was very funny. I was with my wife. I said, I haven't seen Bill in like 2 years, whatever. I said, hey, Brian, so we chatted a little bit. And so I had my 6 direct case type 5, the 6 direct composites. Bill goes, show me your cases real quick, Brian. I said, okay. He's busy, and I respect that. And he goes, oh yeah, those are fine. Those are fine. I said, okay. I said, this is the one I need you to really look at. Tell me which one. And so I showed him the cases, and he goes, Brian, both those pass. I said, are you sure? And he goes, oh, come on, man, that's good dentistry. I said, well, I don't know the level.
Right.
And he goes, no, I said, okay, which one would you have me submit? And he goes, okay, take, number 2, submit number 2, and, but in those days you stood up in front of the examiners, so they had a table, there were 5 examiners, you came in the room, you had your slides in the back of the room, and you presented it. And, I had done some speaking, so I was a little bit comfortable speaking, not as much, but, because that's an intimidating scenario to go into a room of these talented dentists, colleagues that are already accredited at the time, right. And show your work. And then they asked you questions at the end. And
had to defend it like a thesis.
Yeah, you did. But I was very comfortable. It wasn't like, I did the dentistry. I've been doing the dentistry for a long time. Because they say, well, I remember the question was like, well, can you go over your bonding procedure? And I said, okay, do you want to know the adhesive portion of it or the layering of composite? Okay. They go, right. Give it to us all. Okay. So listen, I've been studying adhesive dentistry. I went to the University of Maryland, which is where really, when you think about it, modern day adhesive kind of somewhat started modern day. Certainly, a lot more in the 50s, really developed the acid etching and such. But the University of Maryland, the Maryland Bridge, which we all have Maryland bridges somewhere in our practice. We have failing Maryland bridges too in our practice. They come off, but they can be bonded back on, most of them. But it was fun to know the two gentlemen, Leviditis and Van Thompson, who
Sure.
developed these two bridges, and they were both instructors of mine, so I knew them pretty well.
Hey, Dental Online trainers, I hope that you've enjoyed this first part of our conversation with Brian LeSage. Now, look forward to the part 2 drop of our continued conversation, and we'll see you then. Well, thanks so much for listening or viewing our Sharecast today. If you enjoy this and you want to get more information from Dental Online Training, then check us out at dothandson.com. That's one word, dothandson.com. Now, as a reminder, DOT has so many other great opportunities for your learning. We have our Wine and Unwind monthly webinars where we engage real time with our viewers as we bring in leaders throughout the dental industry to bring you up-to-date information and answer your questions. We have our monthly coffee and donut study club sessions where our participants bring in cases and we treatment plan these cases together to help you bring great treatment to your patients. We have our live virtual workshops where our dental online trainers perform the same techniques from their kits as I'm doing from the comfort of their own home or office. We have our blogs and we have endless selection of our hands-on pre-recorded technique courses to help you improve the clinical dentistry that you can provide for your patients. That's right. With our on-demand courses, you do these hands-on exercises when the time is right for you. So check us out on Instagram, Facebook, or LinkedIn at Dental Online Training. And hey, be sure to share this with your friends and colleagues who you think might benefit from this Sharecast and everything that DOT has to offer. And now, how about one of those coveted 5-star ratings? Please go to your site and help us by getting the word out to others. And we'd welcome one of those wonderful 5-star ratings. This episode was created with special help from Claire O'Neill. It was edited by Ashley Dixon Ellison and with original music by Chris Peterson. Again, thank you for listening. I'm Dr. Dennis Hartlieb, yours for better dentistry.